Hello, everyone. Welcome to Mom's Corner. I hope everyone's doing well today. My name is Zainab. I'm your host, and I'm so excited to be here with you today. I want to thank everyone for joining us. Before we proceed, I would like to remind everyone that, as promised, we will have the stipend link, hopefully in the next few minutes or at the end. I will drop it in the chat box. For those who are regulars at Mom's Corner, thank you for being here. And for those who are joining us for the first time, welcome and thank you. And a big thank you to our amazing doctors for being here today as well. A short introduction about Mom's Corner. Mom's Corner is one of the many programs under the umbrella of Global Perinatal Services, or GPS. And GPS is a nonprofit organization doing amazing work and changing lives every day. And our mission is to provide community-based doula services that will educate, respect, and empower low-income Black, refugee, and immigrant women and their families during pregnancy, birth, and into early parenting. And Mom's Corner has really become a space not just for mom, but for all women folk. Because at GPS, we believe that motherhood is an extension of a woman's identity and not the definition. And Mom's Corner, since the pandemic, has become not just a space where we come together to find empathy, support, and camaraderie, but a safe haven and access to so many critical resources in our communities. And today's topic, we're talking about silent topics in women's health and things that they should tell their doctors. And so, without further ado, I will hand it over to our doctors. Thank you.
Thank you, Zainab. Great to be here today. Such a great showing. This is my second Mom's Corner, and I'm really excited to be back. I am Dr. Helena Gann. I'm a first year, soon to be second year resident at Swedish First Hill. And I can let Zoe introduce herself.
Hi, I'm Zoe, or Dr. Lehman. I'm a second, soon to be third year resident at Swedish First Hill, and I'm so excited to see you all, or at least see your names.
Assalamualaikum, Zainab.
Waalaikum salam wa rahmatullahi wa barakatuh, Bais. So do well. Thank you, Baye, for coming.
Great. So I will get started on our topic today. We have questions on some of the slides that I will just throw out for everybody to answer. I have the chat open, so you can drop some thoughts into the chat, or you can unmute yourself to just join the conversation. Either is fine. And if you have any questions, feel free to drop that in the chat, or just unmute and we can just discuss together. So today we'll talk about silent topics in medicine, and this is mostly touching on what could be considered embarrassing topics, or things that you might not think are normal or common that you are experiencing, that you might be too embarrassed to bring up at a doctor's visit, or you're just wondering, is this normal, is it not? So we can just run through a couple of topics and start the discussion. And this is mostly based in like a clinic setting where you are seeing your primary doctor or OBGYN, and these are just topics that you should feel empowered to discuss. Let me see if I can work this. Okay, great. So the first question I'll ask is, what does everybody think you should share at your doctor's visit? So this can be just your annual wellness visit, not necessarily one that you are going to see your doctor for a specific reason. What are some things that you talk about at your annual visit?
I'll just take a stab at it. I think like medications that you're taking currently.
Definitely. Anything else? Like, it could truly be anything, but I'll just continue forward. The answer is anything. So any questions that you have about your health, any information that you've looked up online. I know there's a plethora of information that you can find on Google. So if you find something that you have questions about, or if you just want to verify, is this something that we have heard about? And we can cross-check it with our sources as well. That's something we're happy to discuss, or any concerns that you have about your health are very valid to bring up. I think something that I have gotten caught into in a visit is talking about too many different things. So I want to help, I want to just encourage you to feel empowered to bring up any concerns, but just recognize that in a clinic visit, there's a limited amount of time, but I would hope that your doctor listens to you and might schedule another visit to discuss your concerns specifically. And a little bit more focused on what we're going to talk about today, just concerns or changes that you're noticing about your body that you might consider embarrassing, quote unquote, could be important to your health, and it could be important for your doctor to know about. All right, so some topics that we'll talk about today, just specifically focused on like women's health, are changes or problems with your menstrual cycle, vaginal health, and questions you might have about that, as well as sexual health. So these topics might feel embarrassing or uncomfortable to discuss, but just know that, you know, your doctor has had training in this and is something that we talk about so commonly. So I would hope that you feel comfortable enough to be able to discuss these topics with your doctor, but we'll kind of go through some things that we think about when a patient brings up some concerns like this to us. So I will start with the menstrual cycle. And so I just wanted to survey the crowd to see what y'all think are important details to bring to your doctor about your menstrual cycle.
Hi, everyone. One thing is, if like it's heavier than usual or lighter than usual, or if you have more cramps than usual, stuff like that.
Definitely. And Taylor in the chat mentioned that if it's an irregular, definitely that's a great one to bring up.
Like how long it's lasting.
Great. I think we've covered a lot of what I was going to say. So definitely the frequency of your cycle, on average, it will last or it'll occur every 21 to 35 days. So every month. And then length of the cycle on average usually lasts between 5 to 9 days, average about 7 days. And then here are some irregularities that you can bring up as well. So this is including bleeding or spotting between your periods if your cycles are shorter than 21 days or longer than 35 days. So that's just giving the range of what is average. Heavy period, so we would consider if you're soaking through one or more tampons or pads every hour, that would be considered a heavy period. Very painful periods that are not responding to the regular medications that help with period cramps, such as like ibuprofen, Motrin, everything in that family of NSAIDs can help with cramps. But if it's not responding, I think that is important to bring up as well. If your periods are lasting more than 9 days, and also if you are missing periods as well. And then I was just a little disclaimer for irregularities that you may be, it is within the realm of normal to have irregular periods when you're first starting to have them. So right around the age of puberty, around 9 to 14, and then around the time of menopause as well, around the age of 50. And just
really normal. Oh, sorry.
Oh, go ahead.
Just also really normal to have kind of odd period patterns right after you've had a baby and when you're still breastfeeding. So definitely something that you can talk to your doctor about if your period hasn't started again after you had a baby, or if things are a little bit different post-baby.
Mhm. Great. And so I will just review a couple of physiological things that are happening in the body when you're in your, like, just throughout the menstrual cycle. And there's a lot of nitty-gritty details in this, but I'll try and keep it kind of like broad picture. And if you have any specific questions, please shout them out. So during a menstrual cycle, are you able to see my mouse? Can y'all see this move?
Yes.
Okay, great. So during a month, so this would be considered a month phase, there are different period cycles or things that are happening in your body. So for the first month, and this top part is considered what's happening like in the ovaries over here, and then the endometrium, this area is what's happening in the uterus right here. So for the first about 12 to 14 days is the follicular phase, which is when the egg or the ovum is getting prepared to be released. And then, as you can see, your hormones are peaking at different times too during this, and your hormones are what is controlling these phases. Once you hit about that 14th day, that's when ovulation occurs, and the egg is released. And you can see that during this time, the uterus lining is also starting to be prepared for an egg that is to be fertilized. And then once we get past the 14 days, it's considered the luteal phase. And that's when the uterus itself is preparing all the nutrients, the blood, to kind of host a fertilized egg. And then if there is no fertilization that happens, that's when the shedding occurs, and that is what your period is. And so all that blood and the nutrients that your body prepared for a fertilized egg gets shed for those 7 days. That is your period. I know that was kind of a lot of physiology, but let me know if you have any questions about that. And I did see a question, I think, about, there were a couple of questions. We can, let me see. Would it be better to answer them now and discuss it now? Or we can wait till the end?
One thing that maybe relates is like at what phases of your period might you have different symptoms, like having breast tenderness or heaviness, was what somebody asked, which might pertain.
Yeah, to hear. So Zoe, if you have a great answer for that, I would love to hear too. But I know that when certain hormones peak, that is when some of these changes and the feelings that you are having during your period.
Yeah. So often period like symptoms like having painful breasts or heaviness in your breast happens after ovulation, because ovulation, like Helena was saying, is when the egg leaves the ovary and is on its way to the uterus to try to implant. And so after the egg leaves the ovary is the time when your body is thinking that you might get pregnant. And so that's between the days 14 and 28 and related to your progesterone spike.
Okay, great questions. All right. So another question I have for everybody is, what are causes of abnormal bleeding or irregular periods that you have heard of?
I've heard of change of diet, like depending on what you eat kind of can affect your period as well. I'm not sure if that's actually accurate, but that's what I've heard. And also stress as well. I'm seeing that people are talking about it on the chat.
Yeah, I see stress, definitely. I'm not sure about diet. If you are losing a lot of weight, and if you have low weight, that can affect your periods definitely. But I'm not sure about a specific or different diets.
Okay.
Okay, fibroids, that's a great one. Let me see. Okay, stress, contraceptives, definitely.
Well, polyps,
Polyps, yes, definitely.
endometriosis.
Great. So I'll just run through them. Pregnancy is a big one. When you are pregnant, you will start to miss your periods and not have periods anymore. So that's a big one. Second is menopause, kind of along the same lines, very normal and physiological. And then problems with ovulation, so hormone imbalances. If you've heard about PCOS, polycystic ovarian syndrome can affect your periods. Thyroid problems can affect your periods, and other just physiological or medical problems. And then problems in the uterus, people really touched on this one, which is great. Uterine fibroids and polyps, things inside the actual uterus can affect your period, definitely. Problems with bleeding also. So if you have a clotting disorder, you might have very heavy periods. And then medications, people mentioned birth control, that's great. It's definitely one that can affect your period. Some people with IUDs might not have a period. And then the pill or the oral contraception can help regulate your period as well. And then this one is a big, bad, scary one, also rare, and not always the most common cause of bleeding or abnormal periods, but endometrial cancer is one that we need to think about, and also one that your doctor might want to rule out if you come to them with abnormal bleeding. Okay. I'm sorry, okay. So other things that you should talk to your doctor about your period and if they're irregular is if you've already been through menopause and then you start to bleed again. So that's your periods have stopped completely and then you start to see some intermittent spotting or bleeding. That's something definitely to go see your doctor about. If your period pain is just debilitating, like we talked about before, if it's really not responding to the common methods of getting through your period cramps, a big one to talk to your doctor. If you feel really weak or exhausted after your cycles, that would be a great one to talk to your doctor, especially if you have the history of anemia. It can be a sign. And if you're younger than 45 and your periods have stopped, that's something to go discuss and bring up with your doctor. Okay.
It looks like, just to say, a lot of folks in the chat are talking about diet and food affecting their periods. And I'm wondering if y'all are feeling like it affects the period symptoms that you have. Like, do you feel like you have more acne, or you have more back pain, or you have more cramps? Or are you feeling like your food choices are affecting how heavy or light your period is, or how regular or irregular?
Doctors, were you posing a question at me?
Yeah, just a lot of people in the chat are saying that diet or food impacts their periods, and I'm wondering whether they're feeling like that's symptoms from their periods, or like how heavy or not or light their periods are, or how regular or irregular.
I was referring to more of symptoms like bloating and such. And so I don't know what everybody else is referring to, but yeah, cramping and all that fun stuff.
Cool, thanks, Anne.
You're welcome.
If anyone has any more questions about that, we can definitely continue to discuss. Or we can
Just
discuss.
if you can clarify, doctor, is it more like it's not the foods that are causing that to happen, but they're kind of a trigger, but not the cause of your period? If you could clarify that, like the like some people are saying they're, the food might be the cause for the bleeding type, or like, how heavy it is or whatever, but it's just your hormones kind of shifting, and like that's a trigger for the process to start, but not a cause.
Right. I have not seen anything about food or diet that affects your period, other than if you're having extreme weight changes.
I
But
do think that there are like some other things, like health things that your diet really affects. And so like Helena was saying, affecting your weight, and also like if you're somebody with diabetes or with pre-diabetes, depending on what you're eating, that can probably make you feel really, really different. But I don't think that the food necessarily impacts how heavy or not heavy your period is, or how regular or irregular.
okay, great. If anyone wants to discuss that more, definitely chime in. If not, we will continue. So these are just things that can be done in the clinic, or things that we as doctors think about to start this workup if you have problems with your period. So things, the more common things would be a pelvic exam in clinic. So that's if you've ever had your routine pap smear, having your doctor check your cervix and seeing if you have any pain with the movement of your cervix. They might do a speculum exam as well, which is the device used to visualize and just to see the cervix. And then we can get some lab tests as well, check your blood count levels, check your hormone levels as well. And that would just be a blood draw in the clinic. Your doctor might want to do a endometrial biopsy, where they use kind of like a thin tube to just get a sample of the lining inside of your uterus. Another thing that they might order for you is an imaging with an ultrasound, or they might order some other imaging as well, and things that can be used for treatment of irregular periods or problems with your period. Could be IUDs or birth control pills. Zoe, do you want to take this one?
So the next thing that we're going to talk about a little bit is zooming out a little bit further from the uterus to the vagina and the vulva. And this is something that often people are like really worried about, want to talk about, but are nervous about bringing up. So I'm wondering what things you might want to talk to your doctor about when it comes to your vaginal health. Are there any questions that you have, or things that you're worried about, or things that you wonder if you should bring them up with your doctor? Odor. Yeah, that's something that comes up a lot. We'll talk about that a little bit more, how people's vaginas smell, how that smell might change. Discharge. Yeah, totally. Anything else that people can think of? If not, we can keep rolling forward. And if you all have thoughts or questions, we can talk about them. So some things that come up a lot for us in the office are people who are worried that they're having vaginal itching, or feeling like their vaginas are really irritated. Like you all brought up, changes in odor and changes in discharge. And then often people are concerned about bumps or lumps or something sticking out from their vagina that wasn't there before. Sometimes people are worried about vaginal dryness, and then often people are worried about pain that they're having with penetrative sex. So I wanted to talk about really briefly why it's important that we have some discharge, because sometimes people are wanting to get rid of their discharge entirely. They don't want to have any kind of a smell, and they don't want anything like in their underwear. But discharge is actually really important because the vagina is on its own, kind of its own little ecosystem. It has its own healthy bacteria and healthy yeast that live in there. And the cells that line the vagina secrete fluids and mucus that help keeps everything moist in there. And that changes over the course of menstrual cycles. So with those hormones that Helena talked about going up and down, the amount of mucus and discharge that you have changes. And you probably have noticed this yourself. And then sometimes we can change it on our own without really meaning to. So sometimes if you're douching or putting soap inside your vagina, or if you're using latex condoms, you're a little allergic to latex, or sometimes with certain partners, that can change the pH of the vagina, and that can kind of change discharge and make things more irritated or uncomfortable. And then it's also important to have discharge because it's important if you're having penetrative sex to have something that's lubricating. So what are things, can you think of any things other than normal discharge, like problems that you might have that might cause abnormal discharge? Or normal changes that cause discharge too?
Like a pH balance
Mm-hmm.
and kind of after your period. Like
Yeah,
your
totally.
discharge. Mhm.
Mm-hmm. Post period discharge can be different. What else? What else causes discharge maybe to be different than normal? Something that you might want to talk to your doctor about. Infection? Yeah, totally. Are there any infections that folks have heard about in particular that people are worried about or that they know cause discharge? Yeast infections? Yeah, totally. STIs? Infections in general? Allergies? Yeah. Hormonal imbalances or changes. There's a lot of awesome answers, you guys. Do you want to go ahead and put up what we had, Helena, and then we can talk about other things too? So these are some of the ones that are most commonly seen in the office. So one is bacterial vaginosis, which is kind of like an infection, but we don't really consider it to be an STI because it doesn't cause any symptoms or cause any harm, except that it can make discharge kind of fishy smelling, kind of thin, white, grayish, bluish. And you can have bacterial vaginosis in your vagina, but it can also live in male partners. And so sometimes people get treated for bacterial vaginosis and then have sex with somebody and then get reinfected with it. So it's important if you're getting treated for BV or bacterial vaginosis that you get treated and also any of your partners get treated too. And then somebody had brought up yeast infection. The discharge that we usually see with that is really thick and white and creamy. Sometimes people say it's like cottage cheese. And sometimes that can cause like extreme itchiness and skin irritation, skin changes. And then there's normal cervical discharge, which we talked about a little bit, that's changing over the course of your menstrual cycle. And we'll look at some pictures in a minute. There's postcoital discharge. So anything that goes inside of your vagina is going to have to come out at some point because it's kind of like a cul-de-sac. It's not an open system. It doesn't go anywhere. So if you put something in it, it's going to come out. So if there's semen that goes in, or if you're playing with anything that's liquid that goes in there, it will come out at some point. And then infections or STIs, people brought up as well. So the most common ones are trichomonas, chlamydia, gonorrhea, and mycoplasma. Oh, and then at the bottom, I said post-pregnancy lochia. So that's after you have a baby, then you have discharge for often like 6 weeks. That kind of changes over the course of that time period from being more bloody to being kind of back to like a whitish color or pinky white color. So that's a time when people are having a lot of discharge too. So because this is something that people worry about so often, I just wanted to show some examples of normal discharge and how it changes during a cycle. So this picture at the top shows kind of the correlation between the discharge and the day of the menstrual cycle that Helena was talking about. So in the beginning and at the end, it's kind of less discharge. It's like a little bit sticky, but it's not like gloopy and it's not stretchy. And then right around the time when you ovulate is when you have this really, really stretchy discharge, like somebody is showing with their fingers on the right side of the screen. And so that's the discharge that you can like stretch really far between your fingers. And sometimes people monitor discharge when they're thinking about trying to get pregnant because they want to know about the time that they're ovulating so that they can have sex during that time. So sometimes this is important when you're figuring out pregnancy stuff. And also it's just important to know if you're like, is this normal? Is this not normal? This is kind of different. What is this looking like? And it's also really helpful when you come to the doctor to say like, hey, I'm worried about discharge, to be able to like describe it a little bit. So you can say it's like thin or thick. You can say what color it is. You can say what it smells like. You can say what it feels like if it feels kind of sticky, or if it feels crumbly, or if it feels creamy, or if it feels like really stringy and stretchy and mucousy. And so then just again, ones that I would want somebody to come and talk to me about, things that I would be worried about, is if you have new fishy smelling discharge, or if it just smells different than normal, if it smells sour or kind of bad, something is off. Probably the pH in your vagina is different for some kind of a reason, and we can work on fixing that. And then if your discharge is green or dark yellow or gray, those are sometimes signs that there's something going on. If it's very thin and watery, that's sometimes an infection that's happening. If you're having pain in your vulva or in your vagina or itching, then I would want to know about that. And if you're having bleeding or spotting after you have sex, then I would want to know about that too, because bleeding kind of falls under the category of discharge. And then super fast, I just wanted to talk about, we often say vagina and we mean kind of like everything that's happening in a woman's body. But I wanted to point out that when we're talking about vaginas, specifically what we mean is the canal that's between the outside of your body and your uterus. And so you can see that kind of at the bottom, the stripy part. And then the rest of it, the outside part, is really the vulva. So if you're having like itching on your outside lips, that's vulvar itching, or itching on your vulva. And then if you're having itching inside your vagina, that's vaginal itching. So sometimes that can be helpful when you're talking to your doctor too, to be able to say which part of your anatomy is making you feel worried about something. And then I know this isn't totally our topic for today, but I just wanted to say a lot of people come in and talk to me about the fact that they're worried that there's something wrong or different with their vulvas, and that they look different from somebody else's or different than an image that they saw. And so that picture on the right is just like 3 very different looking vulvas that are all totally normal. So sometimes people have like bigger outer lips and smaller inner lips. Sometimes people have smaller outer lips. Sometimes people don't really have any outer lips. All of those things are totally normal, but if it's something that you're stressed about, you can always have your doctor have a look and let you know whether it's something that's concerning or just a variation of normal. All right, what are things about your sexual health that you feel like might be important to bring up to your doctor? Also, if this is something that you've never talked to your doctor about, that's totally fine. You can put that in the chat too, or shout that out.
If you have painful intercourse.
Yeah. If sex is painful or uncomfortable or not pleasurable in some kind of a way, that's definitely something that you can talk to your doctor about. I feel like in general, this is something that people often don't bring up unless they're having a really big problem, but it's something that we're really happy to talk about, because sometimes there are things that people are suffering with for like years and years and have easy solutions. So would love to know your sexual health is part of your whole body health. And we're really happy to talk about that if there's something bothering you. contraception for sure is something that we'd love to talk to you about. But like I said, any question that you have about sex, yeah, if certain positions hurt more than others, that's something that you can talk to your doctor about. Usually that's about either how stretchy your vaginal opening is, or about how long your vagina is, what the distance is to your cervix. And so there are some positions that help elongate the vaginal canal more, and some positions that make it shorter. And so sometimes if it's shorter, then if you're having sex with somebody with a penis, that can run into the cervix and be really uncomfortable. Another thing that I want to just call out is if somebody is having sex with you and you are not wanting to have sex, if it's non-consensual, that's something that you can talk to your doctor about and we can help work on with you. We always want to know what types of genitals your partner or partners have and what you're doing with them. So if you're only having oral sex with somebody, then that's important for us to know. If you're having vaginal sex and oral sex and anal sex with somebody, that's also important for us to know because we might do different testing. And then if there's a risk of pregnancy or not a risk of pregnancy, just like Ariana said, that's important for your doctor to know because you might want to talk about contraception or you might want to talk about getting pregnant. We want to talk to you about both of those things. And then if pregnancy is an option, we want to know whether that's something that you want or not, because we can talk to you about how to prevent pregnancy or encourage pregnancy, and then also talk to you about options if you get pregnant and you don't want to be. And then always important to let your doctor know if you have a history of sexually transmitted infections or STIs. So like if you had chlamydia one time 10 years ago and you're not sure if you were treated, that's definitely something that you would want to let your doctor know. And those are all the things that we prepared for you, but we are more than happy to answer any questions that we can answer for you today. And if we're not sure about an answer, we can always send more information to Faiza or Zainab, and we can always refer you to see your doctor. You can come see one of us either at First Hill Clinic or at Downtown Family Medicine Clinic.
Yes, doctors, can you talk to Sister Cell with the painful sex?
Like a urinary cystocele?
Yeah, the one that's bulging through the vagina. Mhm.
Yeah, so cystocele is just when there's like one tube that's bulging out into another tube. So you can have a rectal cystocele where part of your rectum is like pushing into the vaginal canal, or a urethral one where part of where the way that you pee is pushing into your vaginal canal. And those can happen after a delivery where things got kind of like injured during the birth, or sometimes that can happen when people have been through female circumcision. And so that's something that we can deal with in a few different ways. So one way is to do pelvic physical therapy, which can be really helpful in helping you make your muscles strong enough to hold things in a better position for you. Another thing that we can do is there are some like devices that can go into the vagina to help prevent the vaginal canal from collapsing, like pessaries, or we can talk to you about seeing a urologist or a surgeon about surgeries that might be able to fix things and make them better.
Thank you. Yeah.
Yeah.
If anyone has any questions or comments for our doctors, please feel free to share them. Or, yep, you can also private message me as well, and I can ask them. I am curious, doctors, about if there's like a trend that you notice with your patients of color versus white patients, of like things that they don't ask, but you feel like is more relevant to that, to that group, or if there's just, if anything comes up. Yeah.
Helena, do you want to speak to that? Do you want me to speak to that?
We probably have different experiences just given our different clinics. Since I'm at Downtown Family Medicine, I see a very high have a large immigrant and refugee population. So I think a lot of these questions that I ask could also be, it's just different culturally, I think. So sometimes when I try and screen for your sexual health, talking about like different partners and things can be uncomfortable for different populations. So I think I try and just ask all the questions to everybody, but some patients might be more willing or wanting to discuss it than others.
Yeah, I think that's a great answer. I have a lot of patients who are from Ethiopia and Eritrea, and there are a lot of folks who have had circumcisions, and that can really impact people's sexual health. And so that's something that I feel like it often takes patients a long time to talk to me about, because I think it can be like physically uncomfortable, but I think also like Helena was saying, when there are lots of cultural differences, I think people are worried that their doctors might not understand like either what has happened or like what is going on with them. And this comes up a lot of times with birth control too, that some people maybe want to be on birth control and prevent pregnancies, but they don't want their husbands or partners to know that they're on birth control. Or sometimes people feel like they can't go on birth control because of their partners. So there are just like a lot of things at play. And I think that that's why it's really important to have a doctor that you trust and feel like you can be really open with. And I would totally encourage everybody, if you have a doctor that you don't feel like you can talk to about all the things, to like try to find a new doctor that you do feel comfortable with, which can be really tricky and difficult, but is super important, because you deserve to get healthcare that you feel comfortable with and that you feel like you can ask all of your questions in.
Yes. Yep, doctor. So a follow-up question: if some people have like that worst form of what do you call circumcision, do you like, can you help them out by like, cutting or like loosening up the is that something that you do, like reconstruction, vaginal reconstruction?
Yeah, so that's not something that we do in the clinic. Both Helena and I are family medicine doctors. And so for the most part, we don't do surgical procedures, although some family medicine doctors do some surgical procedures. But gynecologists and urologists can do some procedures to help if there's discomfort after a circumcision. It kind of depends on like the way that somebody was circumcised and how scar tissue has formed. But I think in general, there are a lot of different things that can be done to help with symptoms that are happening.
And episiotomy is considered some form of that, I'm assuming, like that would be like an extension of an episiotomy than what they're doing.
Yeah, so episiotomies we occasionally do during deliveries, but not very often. And if we're trying to kind of like extend the vaginal opening without a pregnancy, then that's something that a surgeon would do. But there's also some like stretching that can be done, and there are these tools called dilators that can be used, along with like some massage that can help like decrease some of the scar tissue and help open the vaginal canal a little bit more.
Thank you for answering that. Any other questions, guys, and comments before we let our doctors go? We have 8 more minutes, so we have time. If there are no more questions, I will let our doctors go. And for people who couldn't be here today, our video will be on our YouTube channel. So please be sure to check that out. And then, yeah, thank you guys for coming. The stipend link is I shared it there. We've had really a lot of trouble with that because people are just scamming and just coming in just for that and like sharing it. all over. So I did put some parameters in place, but unfortunately I kind of undid those like right just before the beginning. So I wanted to let people come in. But yes, so there it is. Please fill it out. Thank you so much for coming. Thank you to our doctors. And doctors, I will follow up with you about our next topic.
Sounds
Great.
good. Thank you guys so much for having us. Have a good rest of your day.
You too. Thank you guys for coming.